I started talking about adult hydrocephalus, it was sometimes felt like I was the only person in the room. I'm Mark Hamilton. I'm a professor of neurosurgery at the University of Calgary in Calgary, Alberta, Canada, and helped develop the adult hydrocephalus clinic, which is my primary focus at this time. I do clinical research in adult hydrocephalus. It looked to me like an area that wasn't being paid the attention it was due. There were a lot of patients affected by it, a lot of families with family members affected by it. So we set up a clinic. There are different types of adult hydrocephalus, and we tried to make people aware of those different subtypes, including kids who become adults. They still have hydrocephalus, they need care. One of the largest subtypes is this group that has Idiopathic Normal Pressure Hydrocephalus, which we refer to as NPH. And it's a disease of the elderly. And as our populations get older, we know now what the prevalence and incidence is. So it's a really big healthcare problem. For the majority of people, especially the people, the elderly patients with INPH, the biggest problem and what they start with is a problem with their walking or gait and balance. And the balance part is very important. Gait is the biggest part of INPH. It's the part that's most easily treatable, but like every disease, if you wait too long, damage has been done and you can't repair things. We know that when gait velocity slows down to a certain number, below that, the chance of dying increases to about by 5 times. And that's often due to falls or being placed in a hospital because of your inability to mobilize at all. We really want to know what's happening to people more so when they're outside of the clinic after they've left. We want to be able to have a way to be able to monitor their gait. It's a very exciting device, has a lot of potential. It allows the measurement of many gait parameters or aspects of gait while the patient is out in the normal community, out in their house, going shopping, walking. And that information may eventually lead to the ability to see a pattern that is highly predictive of INPH. I'm in an area where some people would have to drive up to 5 hours to see us in our clinic. So we could potentially do a lot of things remotely. We could make those decisions, sort out whether things have changed enough that they really do need to make that trip to Calgary to see us. The other thing that we could be doing is if we identify a gait pattern that's a hallmark for INPH, we could screen people in a much more effective, efficient fashion. I think it's a win-win for doctors, for patients and families. We're at the precipice of some big changes, and that's really exciting.